Welcome to YARKUD International. Let's prepare for the Saudi Prometric exam. First question. When planning a class on pregnancy, the nurse should include symptoms of pregnancy that must be reported immediately, such as. Okay. So, what is a symptom that is immediately reported? They are asking. Okay. So, here the leg cramps, vision disturbance, swelling of the legs, constipation. So, what are the normal things in pregnancy? Constipation is that? Yes, because there is a decreased peristalsis because of the hormone changes. So, there will be the constipation. Okay. That is normal, no need to report. If it is increasing, uh, cannot able to stool, passing stool, they will be giving the laxative. Okay, so that will be okay. What will be the immediate reporting here? Okay, so swelling of the legs also, it will be normal during the third trimester. So it can be persistent, we have to inform. Yeah, and vision disturbance, that is normal. No, that will be immediately reported. Okay, leg cramps also normal because the calcium will be low during the pregnancy. Okay, so which one will be immediately reported? Vision disturbance. You have to be read all the options clearly and we have to select the answer. Okay, let's see the next one. The parent bring their teenage child. The pediatrician office. The parent reports that the patient frequently complained of abdominal bloating and stomach pain after eating and also having chronic sore throat. The patient lab shows hypokalemia. Which of the following diagnosis should the nurse anticipate? Okay, so here we have to look for the signs and symptoms clearly. They are given the options anorexia, nausea, bulimia, and modified obesity, impulsive behavior. Okay, so here they are given. So impulsive behavior, it is not the impulsive behavior, any behavior not mentioned here. And morbid obesity, anything about obesity, no, that is also not there. So it will be the anorexia nervosa or the bulimia nervosa. Okay, so we have to differentiate. What is anorexia nervosa? There will be the teenage girl, okay, fear to get obese. So they used to do not eating. Okay, so anorexia nervosa, if you see, very lean. They will be very lean. They are not eating. Okay, they are starving. Okay, so now starvation will be there, and there will be the underweight will be there. These and all will be seen sometime because of the not eating, malnourished, and there is a sometime fluid also we will be giving for the patient because they will be giddy and low BP also will complain. So these and all the anorexia now. So what about the bulimia? Bulimia, if you see, the weight will be normal only because they will be they want to eat more. Okay, they will be eating the one time at a time. They will eat the cake, burger, everything they will eat. After eating, they will get the fear. Okay, get the if I just eat this much, I will become very obese. So they get the fear. What they will do, they try to vomiting. Okay, induce vomiting. Okay, so here see abdominal bloating, stomach pain. When it will come, if they eat overeating, it will come abdominal bloating and stomach pain. And second thing you have to remember here, chronic sore throat. Why? Because induced vomiting they will do. Because of that, there is a chronic throat the sore throat. Okay, got the point? And because of vomiting, that's hypokalemia also. So what is the answer here? Bulimia. Okay, so you should be know what is anorexia different from the bulimia. Okay, so these are the symptom of bulimia. So if they ask you any bulimia patient, they will be having not underweight. Okay, anorexia now is only underweight. Okay, let's see the next question. The single most effective way to prevent the nosocomial infection is to. Okay, so what is nosocomial infection first? It will be the hospital acquired infection. Okay, after the admission of the patient, after 72 hours, if the patient getting any new infection, that is called nosocomial infection. Got the point? Okay, here they are given the option, isolate the patient with infection, cover the mouth and nose when coughing, wash all the equipment, detergent, practice continuous hand washing. Okay, all the four options are prevention of infection only. So how to prevent the nosocomial infection? So we have to remember here they are asking most effective way. So we have in the infection, what is the main thing here? Break the chain of the infection. That will be the our management. So break the infection chain of infection by doing what? Doing the continuous hand washing practice. Okay, so that is the answer here. So practice continuous hand washing. Got the point? So let's see the next question. A marathon runner experienced a sudden onset of sharp pain in the calf immediately after the workout. The nurse in the clinic noted mild swelling of the calf and tenderness to touch. Which of the following would the nurse suspect the patient is experienced? Okay, here the option, there is a brucitis and tendonitis, plantar fasciitis, joint issue. Okay, so which one will come? Okay, usually we will just having tenderness. Okay, it will be in the cough. So we choose tendonitis and also not that. You have to remember the key point here, marathon runner. So in the down part of the leg, okay, there is a plantar, the muscles called plantar muscles, okay, plantar fasciitis. So what will be happen? It is joining the front and back part of the heel, okay. So this plantar muscles, because of marathon runner, they will be running for the so long, okay, they will be getting the mild swelling and tenderness in the calf, okay. So they got the pain. So this is called plantar fasciitis. Okay, that plantar plot, there will be the inflammation will be there, itis. Okay, so tenderness will be there. So plantar fasciitis, marathon runner, you have to remember the key point, plantar fasciitis. Okay, got the point? Okay, here the answer is C. Let's see the next one. A patient is recovering following surgery for placement of colostomy. The nurse goes to the patient room to instruct the patient how to care for the colostomy. The patient's roommate has visitors and the patient does not want to participate at this time. What should the nurse do? Okay, here they are asking, the nurse is going to teach the colostomy care, but the patient roommate, that means one room, they have two patients. So patient roommate, the another patient have the visitor. So that time patient doesn't want to participate at the this what participate at the health teaching. Okay. So what does the nurse do? Here the option, document the patient refusal and add non-compliance to the care plan. Okay, it is okay. No, the patient is telling does not want to participate at this time, only this time. That is not the refusal. The time is the problem. Okay, there is a visitors, that is the problem. Okay, so you should not select that. And second one, tell the patient that this is a vital information and may delay discharge. No, not about anything about discharge in the question. Okay, always remember, always take the answer from the question. So anything about discharge as I mentioned, no. So you should not take that answer. C is plan the time convenient to both the patient and the nurse. Yes, that is the good way. We can tell the patient till the 4 o'clock I will be there. Before that, when you will be available, just tell me so that I will be come and teach you. Okay, so plan a time convenient to both the patient and the nurse. Okay, and pull the curtain around the bed and speak, ensure prevention. No, the patient doesn't want. So you should not be do that also. So what is the answer here? C. Plan the time convenient to both the patient and the nurse. Got the point? So when you read the single answer, okay, single options, you will be get the answer correctly. Okay, you have to select the best one. Next one, during surgery, the patient has the following intake and output. Intravenous fluid 650, okay, intravenous antibiotic 50 cc, 1 unit of packed red blood cell 350 cc, nasogastric output 120 cc, estimated blood loss 80 cc, and urine in the Foley catheter 240 cc. What is the patient total output? They are asking output. So intravenous antibiotic, packed cell and intake. What about the output? Nasogastric output, 120 cc. Okay, and then estimated blood loss is 80. So 120 plus 80, it is 200. Urine in the Foley catheter is 240. So 200 plus 240, it is 440. So what is the output here? 440 cc. Got the point? So very easy. They will be mixing of intake and output. You have to separate the output and you have to calculate. Okay. So let's see the next video with the more question. Here the YARKUD International, we are giving the online training for Prometric, SNB, MOH, DHA, OET and IELTS and Oman Pearson View nursing examination.